Yeah, it's a big problem. And most of this, Paul, is due to just common things, alcohol use. Maybe he said maybe a small fraction of it is due to like medications, some of the hepatitis, autoimmune disease. But for the most part, if you see somebody with elevated liver enzymes, a fatty liver or a MASLD is a good bet. And Paul, how are we going to make sure it's not alcohol, though?
Right. To take a step back, the kind of framing for this episode is you have this patient who presents with these slightly elevated liver function tests, or liver enzyme tests, I should say. And where does the workup begin, and when can you sort of assume it's this metabolic dysfunction, and when do you sort of attribute it to other things? So the other things, looking for alcohol use is a good place to start. Alcohol use is extraordinarily prevalent. People have heard me cite the statistic before, but about 1 in 3 adults have met the criteria for alcohol use disorder at some point in their lifetime. So it is a reasonable thing to suspect if someone's liver function tests come back elevated, almost regardless of what their underlying metabolic profile looks like. So one way to evaluate that is, A, ask your patient. That's a great place to start. And then if you're going to look for more objective measurements, there is the phosphatidylethanol test, which is one that is being increasingly used to look for chronic